So we're the Canadian Foundation for Healthcare Improvement. We're funded by the federal government of Canada, and we collaborate with health system leaders at all levels in the system across the country to accelerate healthcare improvement. And we partner with over 100 teams to improve the efficiency, the coordination, and the patient and family-centeredness of care. I was reflecting on our program for today and the title of Patient Engagement, What is it, Why does it matter, and How is it done? And Patty asked me to share a bit of our reflections on that from working with 17 teams over the past several years and working with Ross and understanding the emerging research on these questions. So I think a lot of people think, or used to think, about patient engagement as asking patients what they think. And while that's an important part of understanding the patient experience and bringing the patient voice into our work, when we look at the research and literature and experience, if we're really looking to redesign care, we need to look at a much higher end of patient engagement, and that's really truly collaborating or partnering with patients and families. One of the resources we found really useful in our work and the teams we've worked with is there's many tools available on their website, but the International Association for Public and Participation, and they talk about the foundations for meaningful engagement. So they talk about values-based. If you're going to spend the time speaking with patients and listening to their experiences, make sure you're talking to them about things that are important to them as well as to the organization. Also to be goal-focused, so to be really clear on what is the purpose of listening to the stories. How is it going to impact how you go forwards? Be clear about what the role you're asking them to play if you ask them to engage with you in particularly formal committees and so forth. And thirdly, that it be decision-orientated. What are you going to do with that information, experience, stories, insights that they share with you? So at the Foundation, we think about patient engagement as involving patients patients and families participating in a range of activities, then that they're involved in decision-making in partnership with providers and leadership. And we find it helpful to think about that at 3 levels. And Ross has helped us develop this conceptualization, how we conceptualize patient engagement. First, at the provider-patient level. So this is really about patients being engaged in their own care. People talk about this as shared decision-making, how you self-manage your own care and your ability to navigate through the health system. Then at the second level, we talk about patient engagement and program planning and quality improvement. So how patients are brought to planning tables and help us in understanding how we can design, deliver, and evaluate health services better. And then the third level out, a real culture of engagement. And this is much, as Ross talked about, it's about much more than patient engagement. It's about engagement of leadership at all levels, about frontline staff, and about patients and families. And I had the opportunity to travel and see this really lived out in Cincinnati Children's Hospital, as Ross mentioned, and in the case studies of Georgia Region and other organizations. So these are organizations where really no decision is made without the patient voice incorporated into organizations, and I think it's where we aspire to go and where we see high-performing health systems are at. So this is a slide, I'm glad I credited you on this, Ross. You've seen this slide already from Ross Baker, and it really just driving home the point, we've started talking about it as the trilogy, the engagement of leadership at the very high level and trying to support a culture and outlining that in strategic plans and strategic priorities, and supported by the engagement of frontline staff and patients and families working together. And Eleanor Revoir, who's a faculty on our recent collaborative, which we've named Partnering with Patients and Families for Quality Improvement, has shared at Kingston General Hospital, and you'll hear more about that in a moment, how they prepare teams, so frontline staff, patients and families, the whole team. How do you prepare the whole team to work together for improvement? This is how we connect. I think there's often some conceptual confusion around the concepts of patient engagement, patient experience, patient and family-centered care, and how they connect. This is how we connect them at the Foundation. So when we talk about collaboration or partnership with patients and families and quality improvement, we're talking about patient engagement at the very high end of engagement, not just informing or consulting, but truly working together to bring insights and voices to the table and to work through on planning for improvement and implementing improvement. So we think about patient engagement as collaboration. It's a strategy for improving patient and family-centered care and quality and safety of care. So our goal is not to necessarily see more patient engagement for the sake of seeing more patient engagement. We want to see and support patient engagement to improve the patient and family-centeredness of care, which is often defined by principles of care, and the Institute for Patient Family-Centered Care has defined 4 foundational principles, values that guide your work. It's also expressed in family-centered practices. And Carl Dunst is one of the lead researchers on that, looking at how does those behaviors and practices play out in organizations that are truly patient and family-centered. And we see that expressed in how we currently measure the quality and the safety of our health systems. So why does it matter? When we look across our experience of, as Ross mentioned, we supported 17 teams across Canada in engaging patients in the design, the delivery, and the evaluation of healthcare. And when we tried to look across, what were the impacts we saw? We saw improvements to engagement itself. And I want to just credit Mireille Brosseau, who's in the audience today, a former colleague at the Foundation, who helped us think through when we looked across. This is a really important impact that we didn't necessarily predict at the beginning. That it takes a lot of time to think through how do you meaningfully engage patients and family. What are the changes in the processes that need to take place in organizations? What are the mechanisms that need to be put in place? And that was a huge impact we saw across all 17 organizations. And is an important precursor to be able to go on and see then the improvements to quality in the domains of how we measure quality. And you see them across the impacts across the projects in the various aspects of quality. And we saw huge organizational impacts described in various ways to us, impacts on culture, how we understand the evolving role of patients and families in helping us improve healthcare. And all 17 projects carried on in some form or other after our sort of formal funding period ended. So that spoke volumes to us as well. So based on this, we've just launched a new collaborative, and we had the opportunity to meet yesterday here in Montreal, partnering with patients and families for quality improvement. And we brought together 22 teams from across 6 provinces and 1 territory yesterday to really work through together various improvement projects. And we had as part of the core team, we have a patient and family representative as part of that core team. And they worked through with their project leaders and their measurement leads, driver diagrams, being really clear on what are we trying to improve, how are we going to know that change has taken place. We worked through the sustainability guide from the NHS, which is really about designing for success from the beginning. And there was a tremendous amount of energy in the room, and it really I think already, I'm not a researcher so I can say this, already starts to validate our hypothesis that partnering with patients and families in quality improvement provides different insights and better results than providers working on their own. Some of the research that Ross talked about, he summarized for us in an evidence boost. It's available on the table outside of the room. And as he said, that while the evidence about how patient engagement translates into improvements is not always clear, but there is emerging evidence that engaging patients and families translates into improvements for them and their experience, and also for organizations and how we sometimes view improvement in areas of safety and effectiveness. So how is it done? I'm going to very humbly share a few just really practical tools before I turn over to hear from Kingston General Hospital and McGill University Health Centre, who will really tell you about how it's done and what it looks like. But Alberta Health Services is sort of interspersed and put together the principles of patient family-centered care, so the values that are foundational and guide your work in engaging with patients and families, with the spectrum that the International Association for Public and Participation has outlined. We can think about the different levels or the intensity in which you engage with patients and families. So within our new collaborative, we think about this at 2 levels. Within the core teams that we're working with and supporting for improvement, we're engaging patient family members at the collaborate level. They're part of the core team working on improvement within their various organizations. And then within their improvement project, we're encouraging them to think through how are they bringing in the broader patient population, the voice of patients and families, and that may be at an inform, consult, or collaborate level, or it may move up and down the spectrum throughout the journey of their improvement project. We refer to this as the Alberta Health Services Wheel, and it's just a very helpful way of framing what are the different methods that can be used for bringing the patient voice into quality improvement work. If you look at the top, survey data or concerns data, comment cards, sometimes are dismissed as not very meaningful ways of capturing the patient and family voice. But it depends on your aim, what your question is, and what your project. And they are ways of capturing very large numbers of patient and family feedback. And sometimes, depending on your culture, may be the only way or the mechanism that patients and families have in providing feedback. So I just encourage you not to dismiss them, but not to stop there. As you move around the wheel, we have greater intensity of engagement, and you get closer to understanding the patient experience at the point of care or while they're still in care. Things like focus groups or care provider interactions, surveys at that point of care, as Ross talked about in Northumberland. And as you're moving through the wheel into the green, you see patients and families being put on very formalized and supported roles on quality teams, committees, and councils. We've collected many of the resources that have been helpful to teams we've worked with across the country over the last 5 years into a hub on our website, which is freely accessible, so I just wanted to share that with you and make you aware of it. And finally, before I turn it over to the real experts, I just wanted to share the things we hear over and over as patients bring the energy for change. They help bring the focus to quality committees. What are we really trying to improve, and is it important to patients and families? And this doesn't always have to be difficult, as Ross said, depending on where your culture is at and what the formal supports and mechanisms look like. It can start with every person who interacts with a patient or family. And I'm going to try and paraphrase Don Berwick when he encourages people to say, at the end of an interaction with a patient, ask, how could this care experience have been better from your perspective? And listen. Listen, listen. Thank you very much, and I'm going to turn things over to Eleanor Revoir, who's the Chief Executive Nursing Officer and Vice President at Kingston General Hospital, and Angela Morin, who is a Patient Experience Advisor, and they have been sharing their experience in Kingston General Hospital of partnering with patients and families all over the country within healthcare and into different parts of healthcare. They were just with the Canadian Society for Health Services Engineers in New Brunswick.